In general, welcome to everybody. Sorry for a short delay from my side, but it was related actually to the technical issues. This is my dream, just to deliver the high quality lectures always. So we were testing some new solutions as well for live streaming, but I didn't take under consideration one of the small things which I had to change immediately when we started. So this is just in normal way. I am in most of the cases the host of the Zoom, so and designing all the connections. In general, my preference for today is just to share with you information about dental photography, how important it is in my life and how important it is in general for any dental professional. In the past, because I'm taking photographs in dental field more than 20 years, and at the beginning, of course, we were just more with the solutions related to options like analog camera, slides, presentations with completely different setups. And now we are growing in completely different environment. Now, I live normally in Poland. This is north part, Gdansk, beautiful city. And in general, I have the practice here and I run it together with my team. And we have clinic with 8 dental chairs. We have own laboratory and as well printing centers, lecture room. So everything is set up not only for creating beautiful treatments and documentation for the patient, but as well everything is just focused on the high class treatment with perfect documentation. Because nowadays, in my opinion, but it's not only my opinion, without dental photography, you cannot actually reach a high level of communication, especially not only in between the professionals, but as well with people from or your colleagues, your friends, team members, but what is the most important, with your patients. This is the setup, one of the setups in one of my rooms, where you see the setup for photography, which is like a studio. So more or less, this is a system which is related to the rail system, where you see studio flashes connected with the soft boxes. And this type of solution I prefer, especially when we want to have a lot of light with powerful flashes, where you are limited with the access, which is in my case, especially during the surgeries, because I have to take under consideration safety of the treatment, but as well information for the patient, just to keep everything in a distance and deliver the light in the most, let's say, challenging situations where we have some surgeries. Over the years, I gave a lot of courses about dental photography, and a couple years ago, we created the platform, which is Dentalphoto Master. And this is the platform where you can learn actually a lot about dental photography, starting from the equipment which you should choose, finishing with the lessons, classes, but as well the blog, where we deliver articles about news and as well new things which are related to dental photography. This is the platform only dedicated and focused on dental photography. In the private life, I am together with my wife as pro videographers and photographers, cooperating with different agencies. And diving especially is our big passion, and we love it. And this is the one of the shots where we were filming underwater manta rays, and we are doing this type of materials as one of the crews for underwater documentation, for instance, for Discovery Channel. So we have these options, and in the private life, where we can approach completely different environment, different animals, and it gives us a little bit of, let's say, freedom from the one side, but unusual experiences which affect your mood and as well what you are doing in your life. So if you like photography or you don't like photography at the moment, maybe you should start with maybe easy tasks like maybe taking some pictures of flowers, or just to practice and then start doing this with more confidence in dental field. When we talk about dental photography, I have to admit that I need to highlight, I am talking and teaching about medical documentation. This is not a type of documentation or type of photography where sometimes I see during the courses where the highest attraction is with this kind of artistic photographs. I call it dental porn photography, and because these are certain reasons. Of course, you can highlight, you can make the pictures with the fruits, nice portraits with different moods, but this is like an addition. I'm talking about documentation, something what will help you in a daily work, in your daily practice. Because when we talk about dental photography, we have dental portfolio, case documentation, treatment planning, color and shade analysis, shape and texture, surgical documentation. This is just a few of them, but main, in my opinion, which are in main interest of us, it's dental professionals, dental technicians, as well assistants, hygienists. And we need to understand that the two biggest groups which are involved in dental photo documentations are clinics, doctors, clinicians, and dental technicians. And when we compare the number of, or the type of photography in between these two groups, the main difference is that in the clinic, we take some additional surgical documentation and some procedures documentation related to the treatment. But in the laboratories, especially recent years, we see that technicians take as well dental portfolio, so the set of the full documentation. They want to document their beautiful cases, and actually on the Facebook you can see amazing photos of our colleagues who are taking beautiful pictures, documenting them during the production. They also are involved in the treatment planning. They are involved in color and shade analysis. They take as well pictures of shape and texture just to analyze especially what they do with the teeth, with the layering, but as well they are specialized, in my opinion, in product photography. So just to take beautiful documentation of the shots of the layering ceramics, it needs some understanding of product photography as well. So what kind of tools you should use and how it should be done. When we talk about dental portfolio, first of all, we need to understand that we have to take not only the teeth as a setup, but as well full documentation of shots of the face. Actually, some clinicians will ask me, do I really need all these pictures? Actually, not at the moment if you are not ready to read the information from these pictures. Sometimes enough will be just to take front shots and only write profile, just for the simple analysis or just planning, especially in the 3D environment. But for the clinicians, sometimes it makes sense just to make not only the face, just to take some close-ups of the teeth. What for are specific close-ups or positions? Of course, it comes from the analysis of the cases and planning. So when you need the lips in the contact, when you need teeth apart, when you need a full smile, just to analyze the position of the canines, teeth, asymmetry, symmetries. So this is everything related to the planning, but as well for the communication. For doctors who are involved in the treatment planning, they want to have as well correct documentation of the oral cavity. So we need the close-ups of the upper front teeth, and not only just MIP position. We need as well the close-ups. It would be nice just to have some information about transparency, translucency of the enamel, if it is the case for, let's say, restoring with veneers. But as well, we need to have the the shots in the mirrors, occlusal mirrors and buccal mirrors, just to analyze the contacts, the guidance, the class type of the patient. So this is more for the clinical. In 2016, I wrote a book which is like a display, which is with the information about how to take specific pictures. And we tried to represent in this book, in this display, this kind of information, what kind of setups you need and what kind of communication and what for you need specific pictures. So if you have someone in the team where you refer what kind of pictures they should take, this may be a helpful tool just to have something on the desk during they are in the process of learning how to take these pictures. During this lecture, I will give you some information, some hints and tips, but actually we are in the process because actually in half an hour, 1 hour, it's very hard and difficult just to give you all the information. So maybe in the future later we will create like a course which will be like a summary, but very, very intensive with the demonstration, how I do such a things and what you can actually what you should look for. These are my intraoral photography settings. So I use my camera in the manual mode, and aperture which you set in your camera should be in between f22 and 32 for intraoral shots. Shutter speed is from 1/125 to 1/200 will be just the preference, and ISO is around 200. For portraits, the only difference in my setup is aperture. So I'm coming back with the slide. So with the camera settings for intraoral photographs, you have the highest aperture number with letter F in front. For portraits, you change only aperture to the f11. This aperture will allow you to take beautiful shots with the sharp face, starting from the nose, finishing to the ears. Case documentation is the part of your job, actually. I think about clinicians, but as well dental technicians. Of course, in the clinic, we document the process. And based on documentation which you take, you can make like a follow-up of the treatment. It doesn't matter if it is within 1 hour or it is within 1 year or few years. But the most important is just to control in the photography the quality of your photographs, that we will have correct exposure, correct color, and as well framing at the end. When you look at this composition of the pictures with simple composite, which was replaced or placed, you see almost the same shots, almost the same framing. But what is very important, you have perfect color and control about how they are focused and oriented. And it doesn't matter for me if it will be classical treatment, if it will be general dentistry, it's endo protocols, some prosto protocol or surgeries. I expect from documentation that everything will be in the same color, first of all. So we are controlling a white balance, but as well we are controlling exposures, that they are not too dark or not too bright, and as well cropping. All of this stuff, all of these things we are doing in so-called post-production. So when we download pictures into the camera, into the computer, then in the dedicated softwares, we prepare the exposure, we are checking white balance, and we are correcting everything that all the pictures are exactly with the same color. So we can do it with the surgeries, which is very, very challenging and very demanding, but exposure and post-production, this is one story, but delivering correct amount of light and the quality of light is crucial in such a documentation. I will give you an example of the cases which we document. This is from the short sequence of the pictures where you can see initial setup, problem with the number 2 on the left side, which had to be extracted. So you see a very clean and clear demonstration of the information about what we are doing, where we want to document specific steps. So Also in surgery, it is very critical that we take pictures without too much blood or fingers or anything which actually distract the attention. So for my team, it's very important just to keep the bleeding away, just to use the correctly suction, but in the same moment use, for instance, contrasters and mirrors just to document such pictures. The same or easier, much easier, is just to take the pictures with the prosto. And with these steps, of course, we have to control as well light. And in dental photography, especially, it's critical when we send the information with the color and that we set up correctly our light. Because the worst light or worst type of flash which you can use for the color transfer is the ring flash. If you are using ring flash at the moment, is the worst type of photographs, because you can do nothing with this information, because the reflection of the light is very, very big and you have really problems just to read the information about the color from the tooth structure. So you can use as well for reading the color or checking the color, especially dental technicians, they like it if they have such a possibility. They come with the shade guide. And in our clinic, we have this type of tools where they emit the light, which is 5,500 kelvins. And it gives us this white light just for safe reading with the, let's say, natural or objective light. For color measurements in our clinic, we work with the digital workflow. We have our own laboratory, and in the team I have 7 dental technicians at the moment, where we have international team. I have Italian dental technicians in my team. And one of the best from young generation ceramists, Nicola Squicciarini. And so this is the type of work what we do as well to transfer the information. We are using so-called ELAP protocols. So we take the pictures with polarized, cross-polarized photography, and using the software from ELAP from Sasha Hein, we are measuring and correcting or just trying just to have the correct mixture of the dentin with colors, just to have the foundation for building ceramic, building the crown. Of course, everything is related to the type of the solutions which we want to deliver, but the goal at the end is just to make a digital try-in, which dental technician is doing during the process of building the crown, and it helps a lot at the end just to finish the case and deliver it with perfect results. Of course, the color is one story, and the fitting is another story. Texture, this is high class at the end of the skills. What is very important when we take the photographs, especially on the certain level, we want to get higher magnifications, but these are one of the most challenging photographs. And this is with the ratio magnification 5:1. So you need for this the special setups with special lenses. And this is not the standard type of picture, but as you see from this shot, you can get amazing results showing the quality of the soft tissue before the crown is in place. So based on such approach, we are able just to have really very good results and documented results, where at the end we can compare before and after and show it to the patient, show it to our team, but as well document it and analyze to learn ourselves. Depending on the light quality and the light direction, we are able to read from the pictures information about the texture, and this is very critical, how we position this light. So whatever photography you are doing, at the end, it is just a matter of understanding the light, how the light works and how the light creates this beautiful information about the texture and shape. Information related to the dental treatment and dental planning especially are more related to this medical type of documentation, where we have shots of the face, close-ups and intraoral shots. But there are some rules which we have to follow, and these rules are that face has to be oriented always in a way that we will have the so-called gnatostatic orientation, which means that we align like a corner of the eye with the superior helical attachment of the ear, and it should stay in the same plane. So it is like it was proposed and actually offered for the first time according to my knowledge by Panos Bazos, and this is excellent clinician focused on orthodontics at the moment, but he made his analysis, and this is very, very helpful. I will talk more about these gnatostatic positions and orientation of the face during this course, which is planned in November. I think we have like 3 hours in this next meeting, and then I will go deep in the details, what kind of orientation is it and how to control it and communicate it with the patient. Nevertheless, photo equipment for shots of the face could be used exactly the same as you use for intraoral photography. So it means it's the same camera body, the same lens, which is macro lens, and you can use even flash. However, the power which comes from the flash, which is ring flash, can be too weak just to deliver a good information about the face. That's why in most of the cases, colleagues, they are taking shots with the external light, like speed light flash, which gives better control about the light. This type of portrait which you see was created with the softbox. So it was created actually with one softbox, which was at the top of the patient or in the front, but upper, and with some reflector which was under the chin of the patient. And these are the shots which we are taking in a series. That's why you can see very nicely the position which is oriented. You should see both ears during such pictures, and the chin shouldn't be raised up. You have to keep the face looking straight into the lens without raising the chin down, up or down, because then we will have distortion of the face. Distortion of the face is related as well to the type of the lens which you use, and that's why we recommend very strong that you should use the lenses which are actually macro lenses as well, used for dental intraoral photography, which are around 85-100 millimeters, and these are the best one because it will give you the lowest distortion related to these photographs. So once again, just to repeat, these are my camera settings for portrait photography. Portrait photography we are using in this clinical approach as well, and not only just to take the face, but as well to transfer, for instance, information from the face bow in a quick way, in a simple way, to the articulator. And this type of things, I have to give a credit to André Cardoso from Portugal and Pedro Rodriguez, and from them I learned this method of transfer. So it helped me especially in the past just to transfer in the manual way or analog way the information from the pictures as well to this information about positioning on the planes. Digital smile design, a lot of people heard about it, but less people are using it. We are working with digital smile design every case because it's not only to motivate the patient, but to analyze what we are doing. And actually you take as well shots of the face, but we take as well shot of the so-called 12 o'clock, which is number 5 in this screen. And if you know how to later on use these pictures, or you are a clinician, you send it to a referred laboratory who knows how to use these pictures, just to orient in the correct way in the first moment, just aesthetic design, but as well when you combine it with the 3D modules or 3D softwares, like as well Nemotech or Exocad, you can combine all this information as well, or transfer it into 3D models where you can print the mock-up and work as well with the more information in between laboratory and clinicians. This is the type of communication which we can read from these pictures and transfer it to orthodontists, for instance. So this gives us as well very, very clear information where to move the teeth and how to communicate to the patient, and how to communicate, especially to orthodontists, what we expect, because sending patient without information, this is just lack of information. And then we cannot expect that this type of treatment will go very good. Intraoral photographs, of course, we have two types of flashes which we can use. This is ring flash and dual flash as a standard mode. The same settings, f32, 22, it depends on your camera and lens. Actually, this is related to the lens construction, what is the maximum aperture which you can close or open. But the goal is just to have beautiful close-ups, but with, once again, correct orientation. Correct orientation means like a protocol that every case is done in the same way. It doesn't matter it is just now or in 5 years or in the past 10 years ago. The goal is that we have the same type of the pictures which we can compare. Of course, you can take, besides of this one, anything what you want. But some basics, some foundations should be done in a correct way. Color and shade of the modern approach, I just showed you already with this type of pictures, but this allows me, especially with the digital workflow, to make this type of situation cases without immediately before the surgery happens. Here, patient will lose central incisor number 21. And the goal was just to deliver immediately after surgery perfect crown, which will be in the same color and in the same shape. So based on the information which we sent to the laboratory with cross-polarized photography, Nico was able to prepare such a crown. So then we could start the surgery. We do, I am an implantologist and I graduated in 1993. But I started with implantology in 1996. So I have more than 20, almost 25 years of the experience, but from a couple of years, we are right now only doing 100% cases with guided surgery. So it doesn't matter if it's single tooth or full arch with all-on-4 or all-on-6. So the foundation of such a treatment is, of course, very precise positioning of the implant, because then we can deliver immediately ready to go crown. So if you are very precise in implantation, then you can deliver such a crown. This is the crown which was delivered immediately after. The rule is that we have to have very good photographs. So this is the shot after placement, just for checking how it is in the mouth. And these are the shots showing before and after, the same day, 1 hour later, different crowns. Implant and 2 different crowns. This is the case after healing. So we have quite nice stable position of the soft tissue and the crown, which looks very good, and patient was very happy. Shape and texture, I said that this is just a matter of color. This is just a matter of the direction of the light. So you have to know how to control the light in the volume of the light, quality of the light, but as well where you place, how you position this light. So it gives you the information or chance just to take some shots from the sides, from different angles, just to highlight this type of, let's say, beauty photography, just to show some texture of the teeth. And depending on the direction and the power of the light, this needs some practicing, but it's a lot of fun. And especially when you see sometimes patients with beautiful teeth, you just add additional few minutes more more in your appointment just to take these kind of shots where patients are also involved and happy. So depending on the quality and the volume of the light, you can just register amazing things on the surface of the teeth. And this type of texture helps a lot in the communication with dental technicians, how to really go with these pictures. Product photography is more related to the lab work, but because I work in both in the clinic, in the lab as well, so we are using our facility and the materials and tools which we have just to document it in the perfect way, just to deliver enough amount of light, just to deliver as well this type of pictures which are very clear to understand and very clear to show, because in such a cases you can just show the specific features of the crown, translucency, transparency, shape of the tooth. And product photography in general, in my opinion, is everything what you take outside of the mouth, which needs a special setup like the special tables, or you are doing it even on the mirrors or on the freehand situations. So you can take it with the black background, with white background, and you can make it with different light positioning just to have illumination of the structure, what you can do and how you can present it. Because sometimes if you are the lab owner, you would like to present the quality of the work you deliver. And actually, what is your communication? The only communication where you can convince other doctors just to come and take the chance, give us a chance to deliver this quality. It's just to document and show your cases. So of course you should get as well, if it's possible, some pictures in the mouth from the doctors. But what you are delivering is actually this type of pictures you can take easily. And then you can practice. So I will show it as well how to take such a pictures. Surgical documentation is the most challenging for the doctors, because we have not only patient, not only camera setup assistants, but as well a situation where we cannot make it with endless time. We have limited time for the surgery and anesthesia. So depending on the type of the surgeries, we are taking shots which will document specific procedure, which will document specific type of the protocols or tools which are used, everything just to show how this specific protocol was taken or given. In my case, I am speaker, and I write books and articles. So the quality of documentation for me, especially from the surgery, is critical. So, but in case you are not lecturing, documentation from the surgeries helps a lot in learning process. I learned a lot from my mistakes, which I did during surgeries, during analysis of the pictures, because our brain will always tell you after a while that we did perfect everything, but actually it's not always the case. So we need to understand where is the difference and from where it comes. Recipe for the great photo. This is something which I learned a lot years ago, because in 90s I was as well learning in the New York Institute of Photography. It was for me the foundation of photography skills which I have on the pro level. And one of my teachers told me that if you want to really get a good shot, always think about subject. What is the subject of your photograph? How to focus attention. So it means how to direct your imagination, your focus to the specific part or zone of the picture, and simplify, just to make it simple. And this is, for instance, great example of the veneer, prepless veneer on the central tooth. So if I would just give you this picture without commenting anything, asking what is the title of this picture, you could say easily central incisor or veneer, prepless veneer. So it is just one of the options. Recommendations about the equipment is very hard, of course, to tell, especially when we talk about camera types. So I will just highlight it, just mention it at the moment, because we can go with smartphones, we can go with mirrorless cameras and DSLR cameras. Of course, different solutions, different equipment setup, but at the end, it's important for us what kind of quality we can deliver. So depending on the quality, your knowledge, you will prefer simple solution like smartphone, but from the other side, you would like to have more advanced with mirrorless or DSLR cameras. Macro lenses, this is also the wide selection of this type of tools. And in my opinion, one which you have to remember is, of course, the focal length, just to have to avoid these problems with distortion of the face, but as well the minimum focusing distance. So how close you can go to the subject and still have some space for patient to breathe, to avoid fogging of the lens, but as well to have the possibility to access the light or given access to the light. So we need to really consider all of these steps and before we are selecting. Flashes, of course, in the foundation we talk about ring flash. The more advanced users will look for the dual flash. The people who are already masters in ring flash and dual flash, they will look for even pro solution which are based with studio flashes with the studio light setup. Depending on the type of the light which you will use, you will have completely different results in your photographs, and this is critical. So for your information, this is the example. On the left side on the screen, you see the ring flash picture, and on the right side of the screen, dual flash picture. The same patient, the same time of the appointment, different light source, different light setup. Ring flash, central light, you have huge reflection in the front of the teeth, no information about the color. Dual flash, light is on the sides, that's why buccal corridors are dark, but you have a lot of information about the color in the central incisor. Accessories, different types. Actually, the two which I can recommend, always you will need them at the moment. So this is a self-retracting retractor, the most common which we are using, just to have the front shots and easy access, and mirrors. Mirrors for occlusal shots, I use the biggest one available, and sometimes we trim this kind of retractors just to have better access, and then take very nice pictures of the occlusal shots, upper and lower jaw as well. If you would like to get more reference about the equipment, this is there is section which is free of charge. You don't need to pay anything. You need to just register on the Dentalphoto Master, and you have access to some of the lessons which are for free. But as well, you have access to the equipment section, and as well you have access to the blog. So you will find a lot of references related to the equipment as well. So from my side, I would like just to finish in this moment, and this is what I would like just to say, that this is the moment where I have to find my, okay, I need to find right now the access. Yes, I have it back more. So I will try to give back the host, and we will have then the chance to talk and hear each other. Do you hear me?
Yes, fine. Yes.
Okay. So I give you back the host. So I hope it was worth watching, and for people who are interested in more details, we are ready to go with more advanced information and very practical information.
Yes. Okay. The course will be on 9th of November. We invite all the interesting about to know exactly and in practical way the steps and the protocols how to make professional photos to join us. We looking also for more information for Mr. Dr. Christoph Chmielewski, and thank you very much for sharing this information with us in a dental online conference. Thank you very much. And if there is any
You're
questions,
welcome.
also you can send on the comments on the YouTube. And
Okay. So is there chat visible?
yes,
If there will be something.
yes,
So
only some thanks for this information, and wish we can have some questions. Only some
mhm.
likes for this interesting
Super.
information. Thank you very much.
Thank you.
Thank you. Thank you very much.
You're welcome. Thank
Thank
you.
you.
Thank you. Bye bye.
See you. Thank you. See you. Bye bye.